Hi, my name is Becky Allen. Nice to meet you. I'm going to be doing your physical assessment today. Can you tell me your name?
Sean Allen.
Okay, can you tell me where you're at?
I'm in my bedroom.
Can you tell me what time it is?
It's 6:30.
Okay, and I'm going to have you count by 2 and tell me, I'll tell you when to stop.
2, 4, 6, 8, 10, 12, 14, 16.
Okay, go ahead and stop. Alright, first thing I'm going to do is I'm going to assess your skin, your hair, and your nails. The first thing I'm going to do is I'm going to look at your skin, your overall color, the hair distribution, look for any redness, look for any dryness, any lesions, any wounds anywhere. I'm going to check the temperature and texture. I'm going to check your skin turgor. Okay, and then the next thing I'm going to assess your hair. Being that you shave your head and we don't have a lot of hair in our head, but I do see some darker coloring right here. I'm feeling the texture of this here. It's a little bit rougher in texture on there. I'm looking for any lesions on top of your head. I don't see anything there. The next thing I'm going to look at is your nails. Okay, I'm going to look at the color of the nails. I'm going to look at the cuticles themselves. I'm going to look for any ridges, any cracks in your nails. I'm going to check for skin turgor. Give me your thumbs and do this. This way. Turn around. Put your thumbs together. There we go. Thank you. We'll look at your feet here. Straighten your legs up for me. Okay. Get your toes and look at the color. Looking for any cracks, any ridges. Checking for capillary refill. Okay. Good. The next thing I'm going to do is going to look at your head, your face, and your neck. Looking at your overall size and shape of your head, how it sits on your neck and your shoulders. I'm going to palpate your head. Okay. Let me know if you have any discomfort when I do this. Any discomfort? How about here? Okay. And I want you to open and close your mouth. Okay, good. One more time. And then right here, clench your jaw. Chew like you're chewing. Okay, good job. All right, open your eyes. Okay, what I want you to do is raise your eyebrows. Okay, squint your eyes. Scrunch up your nose. Smile. Frown. Okay, good. And the next thing I'm going to do is have you puff your cheeks out. Okay, I'm going to put my hands on your cheeks while they're puffed. Try not to let me push the air out. Good job. Good job. All right, and the next thing that I'm going to do is
Keep going.
keep going. Is I'm going to put this cotton ball on you like this. Okay, and I want you to tell me when you feel the cotton ball on your face. Okay.
No. 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 No.
Okay.
No. No.
Okay, good. Okay, I'm going to look at your neck. I'm going to look for any jugular veins distension. I'm going to check your trachea here. Okay. I'm going to palpate. Okay, good. I'm going to give you a little sip of water. I want you to hold in your mouth, and I'll tell you, take a drink, but don't swallow it. Just hold it in your mouth, and I'll tell you when to swallow. Okay. And lightly turn your head inside. Okay, swallow. Okay, good. Okay, hold it in. Okay, this way. Okay, swallow. Okay, good. Okay, straighten your head up. Thank you. All right, I'm gonna feel your lymph nodes. Okay. Okay. All right, I'm gonna check right here. And then over here. Okay. I want you to turn your head this way. Turn it the other way. Okay, shrug your shoulders. All right, I want you to turn your head towards my hand. Okay, and turn your head towards my hand. Okay, shrug your shoulders. Okay. All right, the next thing I'm going to do is assess your eyes. So I'm going to look at the eyebrows, the eyelids, the sclera, the iris, the pupils of the eyes. I'm going to look at the conjunctiva. Okay, that looks good. Do you need to wear glasses?
Just to read.
Okay, so you're going to put those on. Okay. All right, I want you to cover one eye up. Okay. Put this at reading distance. Okay. And read me the lowest line on the card.
4, 2, 6, 7, 3, 9.
Okay,
0.
good.
Okay.
All right. Cover the other eye. And do the same thing.
4, 2, 6, 7, 3, 9.
Okay, very good. Okay. Next thing I'm going to have you do is cover one eye. Okay. Now, I want you to look straight at me. I don't want you to move your eyes at all or your head. I want you to tell me when you see my fingers in your vision.
Okay.
Now?
No, before.
Okay. Tell me when.
Now.
Okay.
Now.
Okay.
Now.
Okay.
Now.
Okay. Other eye. Cover the other eye up. Okay.
Now. Now.
No. No.
Sorry.
Okay.
Now.
Okay.
Now.
Good. Okay, I'm down. Just look straight at me. Okay, just look down. Just look straight. Okay, just look over my shoulder, actually. Just look over my shoulder. Okay, perfect. Okay, I want you to cover one eye up. Okay, I want you to look at my finger. Take this hand down. Okay, perfect. Cover that eye up. Look at my finger. Okay, take that hand down. Okay. What I'm going to have you do is look straight at me. Keep your chin straight. Only move your eyes. I want you to follow your fingers with your eyes only. Okay? Eyes up. There you go. Okay. Look up. And look down. Perfect. Now, okay. Okay, good. Now I want you to look over my shoulder far away. Okay, now I want you to focus on my finger. Beautiful. Okay, the next thing I'm going to be doing is looking at your chest and your lungs. I'm going to remove your shirt, please. Okay. Before I do this test, if I notice any type of abnormality while doing the test, I would perform a bronchophony, an egophony, and a whispered pectoriliquy. Okay, so the first thing I'm going to do is I'm going to inspect your chest. I'm going to look to see if you have any respiratory rate. If you look at your respiratory rate, see if you are having any difficulty with breathing, using your accessory muscles, look at any particular lesions on your chest. All right, go ahead and just push straight and relax your arms for me. Just relax. There we go. All right, I'm going to just palpate and you tell me if you have any discomfort anywhere, okay? Okay, any discomfort anywhere?
No.
Okay. I'm going to listen to your lungs, okay? Take a deep breath for me. Deep breath. Okay. What I'm going to have you do is I'm going to have you turn your body and just have your back facing the camera. Okay. All right. So next thing I do is I'm just going to look at just the posterior chest here. Look for any problems with breathing. Look at his respiratory rate. Look to see if he's using any accessory muscles. Look to see if there's any lesions anywhere. Next thing I'm doing is I'm going to palpate. Let me know if you have any discomfort anywhere. Okay, I'm gonna put my hands on you and I want you to say 99.
99.
Say 99.
99.
And say 99.
99.
Okay, so now I'm going to just percuss on your chest here. Let me know if you have any discomfort at all. Okay. I'm going to do next is just take a deep breath in. Okay, perfect. That release. Okay. All right, well, you know if you have any discomfort when I do this. And on this side. No discomfort?
Nope.
Okay, I'm going to listen to your lungs. Take a deep breath in. Okay, I'm gonna have you turn around and face me. I have a couple things I need to do still in the facial area. I need to inspect your nose. Okay, I'm gonna palpate. I'm gonna look for any type of dysymmetry or just off balance with the nasal cavity. Look for any lesions on your nose. I'm gonna actually look up your nose and look for any polyps, any drainage, any bleeding. Okay. And then next thing I'm going to do is going to look at your ears. Look at the symmetry of the ears on both sides. Look for any drainage. Look for any lesions. Look on the back of the ears. Okay? I'm going to palpate your ears. Let me know if you feel any discomfort at all. Okay? All right. What I'm going to have you do is cover this ear up over here. I'm going to whisper something on this side of you, and I want you to tell me what it is when I say, okay?
1, 2, 3, 4.
1, 2, 3. Okay. Cover that up. And whisper something else on this side, okay?
ABC.
Okay, very good. Now the next thing I'm going to do is I'm going to put this tuning fork on the top of your head. What I want to know is when you hear the sound, does it feel the sound equal on both sides, or you hear the sound more on one side than the other, okay?
Mm-hmm. Equal.
Okay, very good. Okay, the next thing I'm going to do is I'm going to put the tuning fork right behind your ear. And I want you to tell me when you don't hear the sound anymore, and then I'm going to move it away. I'm going to put it in front of your ear, and I want you to tell me when you don't hear that sound anymore, okay?
Okay.
All right.
Okay.
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 Okay. Same thing on the other side, okay?
Okay, here.
Okay.
Here.
Okay. Next thing I'm gonna do is I'm gonna look inside your mouth. I'm gonna look at your lips, see if there's any cracking anywhere, any dryness. You could open your mouth for me. Okay. I'm gonna look at your teeth, look for any dental caries, any fillings that you may have, the color of your teeth, looking at the buccal mucosa, the roof of the mouth and the palate, the soft palate. I want the floor. Lift your tongue up for me. Look at the floor of the mouth. Very, very good. Okay, do you have your tonsils?
Uh-huh.
Okay. All right. Say, so tonsils, they're a grade 1. Say ah for me. Okay. Now stick your tongue out. Not like that. Like this. Move your tongue from side to side. Okay. Very good. Now I'm going to grab your tongue with this cloth. Stick your tongue out for me. I'm going to just view each side of your tongue. I can see right here on this side. Perfect. And then again on that side. Okay. Very good. Okay. The next thing I'm going to do is I'm going to check your heart and your vessels. So I'm going to have you lay down in the bed. Okay. And you're going to come over here on this side of it. Put your arms down for me. Okay. Okay, so I'm going to palpate 5 assessment areas of the heart. The first one is the aortic area, which is at the second intercostal space on the right sternal border. And then I'm going to go over here to the pulmonic area, which is the second intercostal space on the left sternal border. Then I'm going to go down here to the herbs point, and this is the third intercostal space on the left sternal border. And then I'm going to go down to the fourth intercostal space. This is the tricuspid area, and this is on the left sternal border. The last one is right here under the mitral area. This is the fifth intercostal space on the left sternal border. The S1 closes with the mitral and the tricuspid valve, and the S2 closes with the aortic and pulmonic valves. The systemic, let me move forward from that, and I'll come back to that. If the patient has any discomfort, or if I find any abnormal findings during my assessment, I'm going to have the patient sit up and lean forward, or turn on the left lateral side, and that way the heart comes forward to the chest. So the first thing I'm going to do is I'm going to inspect the chest area, and I'm going to look for around the heart. I'm going to look for any palpitations, any vibrations, any bruits. I'm going to palpate here also. Okay. Check your temporal arteries. Listen to them. Okay, and then your carotid. Thank you. The other side. Okay. Palpate. Inside. Trabecular pieces. Good. Okay. Thank you. Okay, I'm going to bend your knee. Just keep them relaxed. I'm going to feel the popliteal placenta here. Okay. And the same here on the other side. All right. Sal's piece. So there is systemic changes after S1, and the diastolic changes are after S2. And that completes my assessment for this class. Thank you very much.